psychiatrist speaks here. They need our help. They're not bad people. They just need our help. And he maybe knows some medicine will even help some of them. I don't know. They need a greedectomy. They need a greedectomy. We need to find a good surgeon to take that greed out of them. But the bottom line on it all is that every one of us is here because we understand that. But there's something we all have to continue to do, and that's to talk to our friends, our neighbors, in our citizen forums, in our unions, in our churches. You've got to get us opportunities to get out there and get the word out about how this system could be instead. We need those opportunities. Generate those opportunities. People from Mobilize Ohio, they can come speak. You've got good speakers from Physicians for a National Health Program. You've got good speakers from SPAN Ohio, the Single Payer Action Network of Ohio. We can be out there. We can educate. People will soon see that this reform is not really reform. What we've done is build a third floor on a house with a rotten foundation, and it's going to fall. It's going to crumble. We just added to a bad basis. So get us the opportunities to speak. When you see your state reps, when you see your city council people, when you see your state representatives, when you see your Congress people, when you see your senators, you've got to say something to them and be right in their face about it. That we need a healthcare system that's for patients, not for profits, and we got to fight it to the end. There's a lot of gray hair in this crowd. I got gray hair doing this, okay? And anybody who's young here, this is a fight for the rest of your life. Don't think that this fight is going to be over soon, because they'll try to take it back. We got $2.5 trillion at stake. There's no way that the profiteers are going to walk away from $2.5 trillion. They want their piece of it. So we're going to have to defend. We will win. We will win. You know we're going to win. That's part of why we're out here. We'll win a healthcare system that's good for everybody. It's good for us when we're patients and sick. But we're going to have to defend it when we win it. So that means this organization, whether it's Mobilize Ohio, SPAN, PNHP, it has to go on. It has to go on. It shouldn't just be physicians for a national health program. It has to be physicians for the national health program, nurses for the national health program, patients for the national health program. We've got to fight for it, win it, and keep it. So I'm glad you're out. Thank you for coming. Where's Drew? I need bailout here.
I'm a Kent State student. I don't normally publicly speak. In fact, I'm kind of freaked out and I'm wondering why I did this now. But
don't get close to the edge.
I'm a student in school, and once I get out of school, I won't have any coverage. And I also worked a sub shop. There are many sharp things around me: knives, slicers, sharp edges, things like that. I probably burn myself 3 times a day. But suppose I were to get sick, or I were to take off one of my fingers one of these days, and just to get somebody their food so they can go get diabetes and give people like you more business, that bankrupts me. I start out my life after getting a degree, after 5-6 years of school, or however long it takes for the average person these days, bankrupt. I'll never be able to get a house, a car loan. I'll never be able to get anything because I had a minimum wage job in which I help people out, feed them, I guess. And it seems like a bad way to start an adult life, considering that. When I get older, when I'm out of school and doing whatever it is I do, I shouldn't have to start below zero. I should, I guess, at least start on the level playing field, It seems that young people like me, I'm almost 25, I guess I'm not that young anymore. It seems that we shouldn't start that way.
You're just a kid.
Anyway, we shouldn't start that way.
That's the right idea.
Because the thing is, I'm going to be taking care of you. I'm going to be paying taxes. Many of you, I'm going to be helping out, doing lobbying, maybe other things that people consider useful. And I don't think I should have to start that way. That's all I have to say.
Thank you.
Organize your friends, man. Organize your friends.
I just wanted to mention that in 68 years, I've never been moved to protest anything or support anything. But an injustice to my doctor and Dr. Radigan, who is my wife's primary care physician, it was an extreme injustice that upset me terribly.
Yeah.
Thank you.
We all got to stand up.
Dr. Randt's been my wife and...
Closer to your mouth.
Dr. Randt's been my doctor for 25 years. And Dr. Randt has taken me, healed injuries to my leg from running. He's actually jumped right on the bandwagon and picked up the fact that I was suffering from a C. diff infection before we knew about it, because he knew me. Dr. Randt knows his patients.
That's right.
Dr. Randt has the knowledge and he has the compassion to care for the people who've entrusted their lives to him. It's iniquitous that this hospital is putting profits over patients. And not just that. I talked to Dr. Randt yesterday, and I asked Dr. Randt a question that just blew my socks off. I said, Dr. Randt, did the hospital come to you with any kind of a plan on how to get more patients? No. They're looking for Dr. Randt to be a salesman, not a doctor. For him to go out and recruit his own patients. Were they sending to him referrals for the emergency room? No. They weren't sending referrals to him. They put him in a position to fail. They did not try to help him build the business, to help them to be able to take care of the patients. They set him up to fail, and it's iniquitous.
That's wrong.
I say bring back Dr. Randt back now.
Hello, I'm Bob, and I'm one of Dr. Randt's patients, and I'm an American, and I don't want a Goldman Sachs doctor. I want a Norman Rockwell doctor. And we're Americans, and we deserve that.
Thank you.
My name is Drew, and I'm the coordinator of Mobilize Ohio Movement. We work very closely with Dr. Randt to bring this together today. We have these amazing speakers here. I'd like to encourage everybody here to visit our website, get on our mailing list. It's mobilizeohio.org. Stay in touch with us so that you can be informed when things like this are happening and when we need people to turn out to stand up for these injustices, when people put profit before patients in our healthcare system. Right now, one of our members is going through the crowd with a collection plate. Anybody that has anything, even if it's a quarter, that you can throw in to help us be able to keep doing these events, we would appreciate it. We would love it very much. And is Jerry Gordon here?
So did you make the sign?
I helped make it. There's a team.
Very creative. I like it a lot. Thank you very much.
Uh-huh.
Well, another protest, and the protest will go on and on and on. The struggle is not over.